everyone, I'm Priyanka and today we will talk about CSF, that is cerebrospinal fluid. This is a part 1 video on this topic. CSF is a clear, colorless fluid found in the ventricles of the brain, mainly biochoroid plexus, that is the meshwork of tiny small blood vessels in lateral third and fourth ventricles. CSF is an ultrafiltrate of plasma. CSF is contained within the cerebral ventricles, the spinal canal, and the subarachnoidal spaces surrounding the blood and spinal cord. CSF is reabsorbed into blood through the arachnoid villi of the dural venous sinuses. Now let's talk about the formation of CSF. CSF is secreted by choroid plexus into each ventricle. Choroid plexus are area where the lining wall of the ventricles is very thin and has a profuse of capillaries. CSF is a selective ultrafiltration of plasma. Active secretion by epithelial membrane, whereas some oriented from the ependymal cells lining the ventricles and the brain substance. Talking about the CSF formation, the rate of the CSF formation is about 0.35 to 0.40 ml per minute, or we can say 500 to 600 ml per day. Total volume is around 100 to 150 ml and 10 to 60 ml in new balls. 0.25% of total volume replaced each minute. Having the turnover time for total CSF volume is equal to 5 to 7 hours is equal to 4 times per day. 40% to 70% enters microscopic space by choroid plexus, whereas 30 to 60% enter across epidermal and pili. Talking about the circulation of CSF, CSF is mainly formed in choroid plexus of lateral ventricle. CSF passed from the lateral ventricle to the third ventricle through the interventricular foramen of Monro. From the third ventricle, it passed to the fourth ventricle through the cerebral aqueduct. The circulation is aided by the atrial pulsations of choroid plexus. From the fourth ventricle, CSF passes to the subarachnoid spaces around the brain and spinal cord through the foramen of Mengeria and the foramen of Musca. So this is the flowchart representing the circulation of CSF. Functions of CSF. It acts as a shock absorber, a mechanical buffer, acts as a cushion between brain and cranium. It acts as a reservoir and regulates the content of the cranium. Serve as a medium for nutritional exchange in central nervous system, transports hormone and hormone releasing factor, removes the metabolic waste product through absorption. Let's now talk about the clinical applications of CSF examination. It is used in diagnosis of bacterial, viral or fungal meningitis, malignant infiltrates like in acute leukemia and lymphoma, subarachnoidal hemorrhage, spinal canal blockages. Routine laboratory CSF analysis. CSF is collected by lumbar puncture, an interspace of vertebral lumbar third and fourth. With complete aseptic technique, 3 to 5 ml of CSF is collected. It requires certain precautions and careful techniques to prevent the introduction of infection or the damaging of the neural tissues. Normal CSF composition. Appearance and color, clear and colorless. pH 7.3. Daily secretion 450 to 500 ml. Specific gravity 1.006 to 1.007. Normal microscopic cells, lymphocytes in between 1 to 5 HPF. Normal clinical appearance, protein 15 to 45 mg per dl, glucose 50 to 80 mg per dl, chloride 115 to 130 molar per liter, millimolar per liter, calcium 1.0 to 1.40 millimolar per liter, phosphorus 0.4 to 0.7 millimolar per liter, magnesium 1.2 to 1.5 millimolar per liter, potassium 2.6 to 3.0 millimolar per liter. Normal microbiological appearance, no pathogenic microorganisms. Normally, CSF is a clear and a colorless. Viscosity equal to water. Increase with increased proteins. Color and or turbidity of the CSF. Absorb only in pathogenically circumstances. Turbid CSF. Bacteria, white blood cells or pus cells. Suggestive of CSF central nervous system infections. Blood, presence of blood suggestive of hemorrhage. Subarachnoid or artivesicular traumatic tape are used. Red and brown in color. Red, yellow color, jaundice. Bilirubin in CSF. Hemoglobin breakdown pigments in CSF. Xanthochromia. Xanthochromic CSF suggests that subarachnoid hemorrhage has recently occurred at least within 2 hours prior to taping. The yellow color is due to bilirubin generated in CSF by the breakdown of hemoglobin released from red blood cells, so jaundice should be excluded. Microscopic examination of CSF. White blood cells, normal total white blood cell count 1 to 5 lymphocytes per HPF. Normal differential white blood cell count in centrifuge cell. 62% lymphocytes, 36% monocytes and 2% neutrophils. Increased neutrophils indicate bacterial meningitis. Increased lymphocyte aseptic and viral meningitis. Red blood cells. Normally CSF is blood free. In case RBCs in CSF, subarachnoid hemorrhages and malignancy. Artifact traumatic tapes should be excluded. Traumatic tape, bright red colors, RBCs in decreasing number as the fluid is sampled. Thank you.